many, the term breast cancer can instill feelings of pain, uncertainty, fear, depression, or even death. Hi, I'm Vanessa Kramer. My father, a medical oncologist, asked me if I would do a documentary on how children deal with their mother's breast cancer. At first, I was hesitant because I was afraid it would be too depressing and emotional to witness the trauma and the pain the kids would be going through. But then I realized that this is an important topic to cover, and I could learn a lot from the children and the families I would be interviewing and getting to know. This documentary will help adults see how children deal with their mother's breast cancer and how they're educated on the subject. You will have the opportunity to see the effects of breast cancer through the eyes of a child. What do they know about breast cancer? Who do they turn to for support? How does their mother's breast cancer affect their everyday life? You will also have a glance to see how families cope with their mother's cancer.
My mother told me about her breast cancer the day that she found out, and I had no idea that she was curious about cancer, that she thought that she had cancer. Like, I was totally clued out, and when she found out, it was a big shock to me.
But the entire thing was definitely incredibly emotional. I mean, there was, she definitely said she was afraid of dying, and that I don't think I cried in front of her ever, but it was certainly extremely scary, and I didn't know what to expect.
First impression of understanding that your mother has breast cancer is revolves around something like death. I mean, most people nowadays, when they hear of death, or it always is associated with some type of a negative connotation. It's not just, oh, well, you have cancer, you'll survive. It's usually you'll have cancer and you might die.
I asked the parents how they went about telling their children about their life-threatening breast cancer. Shireen Byrne, who had successfully beaten breast cancer 2 years earlier, had found out in an emergency room that her breast cancer returned and spread.
And after being told, of the extent of the illness, basically that I was terminally ill, I had cried leaving the emergency room. And I was by myself, and it was a big blow. I had cried, but I had regained my composure. By the time I came home, I guess my eyes had still been red. And Johnny came to the door and he said, Mom, where have you been? What's been taking you so long? And I said, well, Johnny, I'm really sick. And he says, well, what did they say? And he says, why are your eyes so red? And I said, well, I have an eye infection. I wasn't really ready to tell him.
At first, my way of approaching things was not to tell her, because the way I was raised, my parents really felt that if something were very serious or frightening, children shouldn't know about it. And so I started with that kind of mindset. But then after talking to some of my professional colleagues, psychiatrists, psychologists, they said, that's very wrong, because she will feel very left out, and she may be very angry when she comes home to find out that all this happened during the time that she was away at camp.
I was away at camp, and we were actually not allowed to talk on the phone. And I snuck to the phone on Visitor's Day, and I called her because I had been really worried for like a few weeks because I didn't know what was going on. So I called my mom, and I asked her if everything was okay, and she said no. And I couldn't talk. I had to go because I wasn't allowed to be there, and I was sort of like crouching in this phone booth. And it was really, really bad, because all that I knew was that she had it, and I couldn't really talk to her at all, and I just went back to my cabin. I was a mess.
I don't think there's ever a right time to really share something with your children like that. There's never a right time to let them know, that you're really sick and that you may not make it. The evening that I came home from the emergency room, it was apparent that I had been upset myself. And I'm not really one not to share things with my children. We're very open, and we talk about everything. I think it's really important that people take the time to share with their children, and that's what I did that evening.
My kids learned the same day I did that I had breast cancer. My husband and I came home from the breast specialist, and I think we were actually in shock. And, we didn't know what to think. And so we just gathered both kids and said, come on, we're going to go out to dinner. We've got to tell you something. And said, we have a health issue. I think that's how we described it. It's kind of a big blur. But my daughter said, do you have cancer? And I said, yes. And she said, she was really upset, gave me a hug, was sweet.
With the families I interview, there are two different approaches to involving the children. One, to shield them, and the other, to be completely open with them. I spoke with Laura Palmer, doctor of child psychology, and asked how parents could best help their children through this difficult time.
I think being open with families and children and teens in particular is probably one of the most critical aspects, I think, of helping families and teens cope well with an illness such as cancer. Part of my experience has been working with a group of adolescents who themselves had cancer, and their parents were in a support group next door, and I was running the group with the kids. And one of the most important things that came out of that was the teenagers saying that they felt very betrayed if they weren't given enough information about their own illness. And they also said that if they had a member of their family who was sick, they really wanted to know information.
I did have a lot of questions. Mostly I wanted to know how bad it was and if she was going to live. And she always would say, oh, I'm going to be fine. It'll be, it's, medium cancer. Of course I'm going to live. But a lot of the times I just felt that she was lying to make me happy or for me to not worry about her.
One thing that's important with children and teenagers in particular is that if a child finds out some information about their parent's illness, sometimes school-age children will actually personalize it and think, gosh, what did I do to help make mommy sick? And is there something I can do to make it better? And that's why it is very important to give them as much age-appropriate information as possible. With teenagers, they've really expressed to me in my own experience working with them that they would want to know what's going on because they tend to pick it up anyway. And I think one lesson I've learned sometimes the hard way is that if we don't tell kids and teenagers what's happening, they hear it in the hall from a doctor, they hear it over the phone from a mom telling a relative, and that can be very devastating because it sends a mixed message to the child and they're wondering, wait, is mom really okay, or is this worse than I thought? So the direct and honest information, even though it is scary to tell a child or a teenager, that really can alleviate a lot of anxiety.
Well, at first, not much. It's not like a doctor called me up and said, Roberto, you know what, we're going to do this with your mom. She's going to go through chemotherapy. It was more of, I heard, second person, I heard my mom tell me, well, they say I should do this. And so it was a situation where I only knew what my mother was telling us.
I gave them a lot of information about the breast cancer. I had a book that my breast specialist gave me that he'd written, and I went to the bookstore right away, got books, and I think I plied them with information. I just wasn't going to hold anything back. I just didn't think it was anything to hide.
I had an interesting perspective on that because my sister had Hodgkin's disease when she was 15 and when I was 14. So I'd already dealt with a cancer and cancer treatment in my family, and I wasn't too far from the age of my children when I went through that. And I remember that experience as being really kind of baffling and horrible for me.
I was pretty open with them from the start. It was really frightening. When I was diagnosed, we were living in France, so I was in a foreign environment without family or friends for support. We came back to America for my surgery, but that was a short trip. Then we went to England, and I went through my first course of radiation and some subsequent therapy in England, which was easier than France, obviously because of the language barriers, but still a different system. My children, of course, noticed that I was always going to the hospital. And I tried to explain to them what cancer is without scaring them too much.
This would have been back in 1971, I think, that happened. And the treatment, even though it was successful with my sister, was very extreme, and the chemo was really, really difficult. Hard on her body, hard on her. She came home every day and was vomiting and screaming, and it was really intense. And I of course was concerned that what Holland was going through would be, I wanted to make sure it wouldn't be as bad as that, and I kind of felt, well, it's 30 years later, so the nature of cancer treatment has changed, but chemotherapy is chemotherapy and radiation is radiation. So I I wanted to make sure that that the kids understood, you know, how difficult the treatment would be.
I didn't want to sugarcoat it, but I didn't want them to be as afraid as I was in the first year or two after I was diagnosed. That was the most frightening time for me, and I wanted to protect them from feeling that afraid, that it's not a disease that's without hope, you know. But they know, and, you know, they knew when I had my breast removed.
This brought up the question of age-appropriate information. Dr. Laura Palmer had this to say.
There is a huge range of the cognitive capacity for children and teenagers. In general, if you're going to stereotype, teenagers can concretely understand that death is permanent, that it's not reversible, and that parents aren't going to come back. Whereas young children who are 4, 5, and 6 won't understand.
One of the parts that I know of the treatment is that it's called chemotherapy, and she has to sit in a chair and get medicine injected right here.
Weigh on the side of honesty and really know your child. And if you know that, you know, one child in particular tends to worry a lot, it's okay not to give them every detail about an x-ray or a new report. But letting them in on information really can ease their anxiety, and they can handle it. But giving them the opportunity to ask you questions and really gauging what they want. Let them tell you, this is the kind of information that helps me.
My parents tried to keep everything from me. So they didn't really want to tell me what was going on because the first year I was at school, at the beginning, it was really, really hard for me, and I really wanted to come home. I was so homesick, and they knew that if I knew a lot of what was going on, it was so much worse. They just sort of said that it was going to be okay, and they didn't really tell me much. And I'm pretty sure that's because they didn't want to worry me.
Other times we really are genuinely afraid that we're going to upset our little 7-year-old. And so, as I mentioned, you know, briefly before, age-appropriate discussions are important. Explaining things in the developmental terms that your child can understand. For example, you know, if you have a young child who loves, you know, a certain toy or doing something, parents can use that as a way to say, you know, remember when your puppy was sick and we had to take him to the vet? I mean, if you have a young child, using analogies that are actually real in their life. It may sound silly, but you need to help that child actually relate to something they can comprehend in their world. And it may be a little puppy being sick and saying, you know, right now mommy's going to a doctor that is helping her, just like our vet helped your little puppy.
I found out about my mom's breast cancer because she told me that she had it, and I do remember a little part where she said, Lily, say goodbye to this part, and I said bye-bye.
When it's an older teenager, I think you have to really follow the cues of that child. I think if anything, our medical field as well as mental health professionals, we weigh on the side of being overly cautious about sharing information. And what teenagers and families have told me is that getting honest information and really feeling like people are letting you know what's happening is incredibly powerful.
I think my kids are coping really well with it. You know, I say that, I don't know how they're doing. My daughter is much more out there about it. You know, she wanted to talk to a counselor about it. She's interested in it. She's very compassionate. She'll talk about it. She'll want to know how I'm feeling. My son, who's 14, is just totally shut down, doesn't want to talk about it, and I kind of force it on him. You know, I force him to talk about it. I just say, have you noticed, you know, this is what I'm doing, or I give him a lot of information.
I then wonder how families dealt with their children's varying reactions to this ordeal. Would they become reclusive or open up to their parents?
I think it was best for us to take the cues from the kids. And the one daughter that was more to herself, we didn't force anything on her that she didn't come looking for, and that was probably beneficial. Yet the daughter that really wanted to be more involved was allowed to participate more.
You know, it's tricky because they're teenagers, and it's that, I mean, some of their behavior seems age appropriate, but my son, who's 14, is a little more, I guess, rebellious, wants to be with his friends, doesn't really want to be around, just wants a ride, he wants to hang with his friends. So I don't know if that's because of my cancer or because he's 14.
It's challenging to know, is this my child who's a teenage boy, or is this because I have cancer? And I think that's probably one of the biggest struggles every parent, especially the mom with cancer, has, because they want to be attuned to what's happening for their child.
I think that in the beginning they're always extremely sympathetic and emotionally affected by it. They're upset, they're concerned. But as with a lot of problems in life, you get used to it. And then suddenly the real caring concern at times would turn into an annoyance in the sense that, I wasn't available to go shopping with them if they needed it.
I can't sometimes get to do what my other friends get to do, and they can't get to do what I get to do because of what's happened.
I asked the children what the worst aspects of living with breast cancer were.
For chemotherapy, I know in the beginning she was really nauseous.
She was sometimes nauseous, very tired. Those were basically all the side effects that she had. And, of course, losing her hair, that was the big one.
I knew she was going to lose her hair. I think that was the first thing that made me realize the severity of what she was going through.
I think my head being bald and being really cold was the worst.
Just the incredible change that she went through was really became clear at the point where we went to buy wigs, and then when her hair started falling out, it was very it was the emotions that I went through were indescribable. I couldn't handle it. I was losing someone.
I'm not really that worried because it doesn't really bother me. I just let her handle it because she says not to be scared, so.
It was scary.
So how could doctors and professionals help the families cope?
If there were to be something for the kids, for them to, some professional help for them, and with the doctors that they could talk to the kids more. I know there was no connection between the kids and the doctors that helped my wife at that particular time, but I believe if they were to be there, it would have probably helped.
I think it would have been really helpful to have medical, like another source of information, rather than it all just coming from me.
I think that would have made me feel a little bit more comfortable, and there would have definitely have been more trust, because I've never even met my mom's doctor, and the two people I've met were my mother's nurses for chemo, and I think that would have made me feel a little bit more comfortable.
And sometimes the kids will listen more to a doctor than to me. They'll say, well, they'll trust the doctor a little bit more than me, because they say, well, Dad, he's an electrician, he's great, but he's not a doctor. So
if a doctor would sit down with someone and say, listen, this is what your mother has, this is what we can do for her, and if you lay it out the cards on the table, the person's not questioning or is misinformed. It's a direct, clear, communication between doctor and I guess the family. It allows for greater understanding of what the person's going through.
The role of the medical team is one that is pretty diverse and complex in the sense that obviously they're going to be providing the person who's been diagnosed with cancer with detailed information, but it's amazing how many families will tell me that, wow, I didn't know enough to really help my mom. And having a teenager or even a child hear from the actual physician who's treating their mom, get a good explanation and hear, wow, this is what we're going to do with your mom. She's going to come in 3 times a week for chemo. She's going to probably feel sick on these days. Some days she may be a little tired. That kind of information, when it's told directly to a child or teenager from the doctor that knows the mother, is incredibly powerful.
Well, the thing is those guys are really busy. Those are kind of hardworking oncologists. Yeah, if they had the time, I think it would have been great.
As many families have told me, they know that doctors are very busy and that it's the quality of the time that they spend, not the quantity, with a family member. And I think as professionals, I'm a mental health professional, I work with many medical team professionals. It's really hard to balance having enough time to do all of these things, but spending that extra moment actually with that teenager to say, your mom really is doing well. I know you're afraid, and you've told me that you're afraid your mom's not being really direct with you about it, but she really is following through well with treatment, and to the best of our ability, we know she's doing just where she should be.
I feel with my most recent diagnosis, I'm in total remission from stage 4 breast cancer to my liver. I feel that it has so much to do with him and the support that he gives me as a patient and the time that he's taken with my children in the chemo room to always come out and talk to them, to ask them how things are going, how are you feeling?
When I did go to chemo with my kids, the nurses, the doctor, everybody was, friendly and really, really nice.
Actually, Dr. Newman would always talk to us, and if we had any questions, he would always completely answer them and assure us that my mom was doing okay. We always had a fear because my mom would never really mention that things were going bad, so we were thinking to ourselves, well, something must be going bad. I mean, she's handling it so well, and it's supposed to be such an awful thing to go through. There must be something she's not telling us. So we would ask the doctor questions, and he would reassure us that my mom's treatment was going perfect.
There is actually quite a bit of, controversy at times around people talking about how much information to share with children and teens. And it's interesting because both in medical professions as well as the mental health profession that I'm in, it's a very difficult topic, and it's hard for us to think about death. It's hard for us to think about illness. And what it does is it brings up for all of us as professionals, wow, if this could happen to my patient, this could happen to me.
I spoke with Dr. Tripathi, a medical oncologist, on how he communicates with his patients.
Well, I treat patients primarily with breast cancer, and so I'm involved in their consultation regarding their medical diagnosis and what the treatment plan is. And most of my interactions with the children of patients are in the context of discussing this with the patient, so mostly providing information about what their diagnosis means and what the treatment plan is and what we think the expected outcome is going to be. So many times I will amplify on what this means to try and put it in perspective for the child, depending on the age of the child, to put it in terms that they will understand what is cancer and why do we need to treat it the way we do. And the most important thing I can provide them in the initial visit is just the facts. Not always do the families or does the mother want to bring the children in, but when they do, I think the most important role I can fulfill is simply getting the facts to them accurately and in a way that they can understand. They don't know how this cancer might affect their mother. Is it something that they will die of, they might die of, or something they probably won't die of? And of course, every situation is different. So I try to be as accurate as I can with the child, and I explain to them one of the important factors that sometimes is misunderstood, that this is no one's fault, and that the best thing that they can do, and that both they as children and their parents can do, is to work with the treatment plan to keep an open line of communication both with family and friends as well as with the medical team, and to little by little get familiar with the situation, get a level of comfort with the new reality of life.
I asked Laura Palmer how parents can ease the tension of living with breast cancer.
The kids who end up doing well have been able to start to articulate what they need in particular. It may be, as I've had one family tell me, a little boy came in and said, Laura, I just don't want to talk about cancer all the time. I don't know what to do. I don't want to hurt my mom's feeling, but I feel like that's all we talk about. And ironically, knowing the mom, she would love to have more normalcy in her home. And so this boy was about 9 years old, and I told him, I said, you know what? I bet if you went home today and told your mom all about your soccer match and everything you did, she would be thrilled. So do me a favor and try that this week and see what happens. And he was thrilled to see that, wow, he was able to change the atmosphere in his house by being himself. And that really did help his mom.
Although the families I spoke with managed well with their crisis, many families struggle. I asked Laura Palmer what help was available.
For families who are dealing with breast cancer and struggling with whether they're getting enough support and if they're getting enough support for their children, I think one thing to remember is that this is a process that is very unknown. There's not a right way to deal with cancer and a wrong way to do it. It's very individual for families, and I think one thing that can be very helpful is to seek out professional help and resources when they're needed. That's nothing to be ashamed of. It's something that's out there, and group therapy is also a wonderful resource both for children and their parents. As someone who's run groups both for adults and kids dealing with an illness, it can be a really nice way to have people around you who can relate to how you're feeling. Don't hesitate to seek out that extra help, because that model that you have of going out and asking for help can really be a wonderful example to your children.
The families I interviewed wanted to offer their advice for living with breast cancer with others.
I would say, be as honest as possible and be open. I think kids know a lot. They get it. They pick up on stuff. They're like sponges.
Don't overly focus on it. Treat every appointment like you would a haircut.
That they need to be positive and just not to dwell on it, not to make it your life.
I think you got to share it and share the information, share the fear, share the joy, share it all.
Thank you for watching this documentary. I hope you found this informative. I'd like to thank all the families that participated and leave you with the words of Natalie Lehman.
I didn't know about my mother's doctor appointment that day, and if I had, I doubt I would have worried about her. When she arrived home 7.5 hours after her doctor appointment had been scheduled, it still hadn't occurred to me that she might have been sick. My family met in the hallway, and my mother began to speak. She told us about her doctor appointment that day. Even though I knew the answer was no, I said the worst possible ailment that came into my mind. I settled upon cancer and blurted out once more, "Cancer." The most horrible look settled across my face as she replied yes. As my family walked outside towards the car, I pretended I had left something in my room. I dashed to my door and collapsed on the ground. Tears filled to the brim of my bottom eyelids and gently fell down my face. I hopped into our car as I drifted into a thick fog. Our car lurched forward as we turned into the parking lot of the restaurant, and I shook my head slightly. I hadn't even noticed the tears that fell down my cheeks in the car ride over. As my mother leaned over to lock the car door, I wrapped my skinny arms around her and hugged her. I hugged her as if it was my only chance. My mother kissed my cheeks, and we walked into the restaurant holding hands. Throughout dinner, we pretended as if nothing was wrong. My mother leaned over and whispered, "Don't be scared, Addie."
Born of the earth, child of God, just